Hello, and welcome to the bite-sized version of Recognising and Managing Dyscalculia and Mathematical Difficulties. My name is Dr. Ashraf Seedat, and I'm one of the Senior Educational and Child Psychologists here at Bradford Children's Services. So, some of the key references we'll be using in this presentation is the Williams Review of Primary School Mathematics, the Dowk Review of What Works for Children with Mathematical Difficulties, and the follow-up Dowk review for What Works for Children with Mathematical Difficulties 5 years later. They're the key references, but other pieces of research on mathematical difficulties and dyscalculia are also included. So we'll go through what the word dyscalculia means to different people. It means a variety of things, and it can be used in an inconsistent way that means different things to different people. So it's always good to get a good understanding of what people are actually talking about when they use the word dyscalculia, and dispel any myths about dyscalculia as well, because some people will refer to it as a dyslexia for numbers, which within reason is accurate, but not accurate enough to be able to deal with dyscalculic children appropriately. So we'll be looking into that and discussing that to begin with, and then looking at definitions. So one of the first ones we'll look at is the neuropsychologist definition, and that talks about an innate ability to recognize numerosities. Now, it's very useful for neuropsychologists to work in this way because they're thinking of brain functionality and brain plasticity in terms of dealing with impairments in the brain. But it's far more difficult for somebody to apply that in a more educational setting. So we will look at other definitions as well. But just sticking to the brain theme for the moment, we look at the various regions that have been identified as involved in developmental dyscalculia, discussing what role they play, how they could be affected, and what impact you might see in children who've got impairments in those regions, and some of the pitfalls of using this model as well in terms of thinking of brain-based disorders and brain-based problems. And looking at developmental dyscalculia, we see that children exhibit very strikingly poor performance on simple number comparisons and counting small numbers of dots. And this is likely to affect something called an impaired number concept, which is what the neuropsychologists quite often refer to. And one of the most prominent ones is Brian Butterworth. And he's developed a dyscalculia screener, which uses the reaction times to tasks to count dots and magnitude comparisons and that kind of thing. It's the kind of activity you can't improve on because it's supposed to be done so quickly that if you've got dyscalculic tendencies, the time gap that you make will always be significant and will always indicate that you've got dyscalculic tendencies. So it doesn't matter how many times you do it. It is about being very, very quick. And generally, dyscalculic difficulties are about the time, because lots of people can do mathematics if you give them long enough. Dyscalculic people just need that extra amount of time to process mathematics and numbers and come up with reasonable responses. And we'll look at the DFES definition as well, which was written in 2001 and has never been repeated. So it's well over 20 years old. But this is more useful for an educational setting because we're looking at learners who lack an understanding of simple number concepts. They lack an intuitive grasp of numbers. They have problems learning facts and procedures. And even if they get the correct answer, they might do so mechanically or without confidence. And you can probably think of lots of children who fit into that category in your settings. And so it's a more useful definition, but it captures a lot more children than would otherwise be dyscalculic. So it's a bit of a difficult definition in that respect. Now, dyscalculics often count in ones with their fingers, and that's one of the hallmarks we find, one of the sort of characteristics of children. Now, that doesn't mean that children who count with their fingers or adults who count with their fingers are dyscalculic, but we feel that dyscalculic children do that more often, and quite often they don't realise that one of their hands has got 5 fingers and they don't need to count each single finger every time they count, and it takes them longer to realise that compared to other children. They don't make sense of numbers easily, they don't recall number facts easily, and they can't generalise either, so they might learn 10 take away 6 is 4 in one context, but in another context they'll have to figure it out again from first principles. And as you can imagine, they're going to be discouraged and anxious in maths lessons and develop avoidance strategies, which is not a surprise really, is it? When you find it so difficult and so challenging and so exhausting to do mathematics. Now, dyscalculia affects about 4 to 6% of the population, so a significant number. You'd expect 1 or 2 children in a class to have dyscalculia by that figure, but compare that to the 25% who have numeracy difficulties, so a much greater number who have difficulties at some level with mathematics. Now, dyscalculics can master areas of mathematics that don't depend on manipulating numerosities, such as algebra and geometry. So it's not as if all mathematics is lost to them. They can do things that don't involve numerosity quite well, and algebra and geometry are quite complex areas of mathematics as well. They tend to take an abnormally time-consuming manner to deal with numerosities when they do, and they tend to be of normal intelligence, emotionally stable and motivated to learn, but they don't appear to be responding to remedial teaching. And I'll discuss an example of a 20-year-old man called Charlie, who's a psychology graduate, but is dyscalculic. But so he succeeded in life in terms of getting a degree in psychology, which involves a significant amount of mathematics. But he couldn't tell you, for example, that there were a couple of dots on a page without physically counting them. People have said different things about dyscalculia. Dowker, who's done a lot of work at Oxford University, thinks it's best to think of it as at one end of a continuum of numeracy difficulties, and it's best to look at how we can support children rather than probe for causation and give them labels, because labels ultimately don't mean anything. We need to find out what children know, what they need to know next, and find ways of scaffolding that progress so they can learn. And some of the strategies that we use work for children regardless of the label anyway. Now, it's become very important to address numeracy difficulties. There's been a recent increase in interest in the area. We generally, on an international level, we do as well as other countries in terms of science, but not with mathematics. And even though there's such an overlap with science and mathematics, we don't really know the reason why. So we're looking into that in more detail. We have a significant and stubborn tale of underachievement. About 6% of our children leave primary school without level 3 in mathematics. And that cost to society for that failure for those children to master basic numeracy at primary school level is £2.4 billion, and £763 million of that is just for the numeracy with no parallel difficulties. So we're talking about huge numbers here, which it's no wonder that the government wants to get involved and try and nip these difficulties in the bud, because there is a huge cost to the public purse later on. A piece of research done later on in March 2014 estimates that the cost for the entire working population, not just those children who leave school with level 3 maths, but the entire working population, is about 20.2 billion, with a range of 6.7 to 32.6 billion. So again, huge numbers, and that doesn't include unemployment costs. Now, these are the 5 areas that were identified by Gross et al. In 2009, who looked at the children who leave primary school with level 3 numeracy. So you've got costs of crime there, you've got educational costs in terms of special needs, you've got educational costs in terms of exclusions, you've got employment costs, and you've got health costs. So far-reaching consequences for children who don't seem to do very well in mathematics at that primary school level. So all the reason to make sure we provide support for them and move them forward in a positive manner. And a research done by the Government Skills for Life survey, about 8,000 adults they did their research with. They estimated that 15 million adults would have numeracy at or below an 11-year-old, and of those 6.8 million would have numeracy skills at or below that of a 9-year-old. So these people are going to struggle with things like times tables, number facts, converting between currencies and measures, working out percentages, fractions, taxes, that kind of thing. Now, there's apps these days that can help you deal with those issues, but you still need to have some idea of magnitude to know what kind of thing or what kind of answers you're looking for, and so you don't get bizarre answers or get fleeced in a shop, for example, or get underpaid in your wage slip because you don't have the capacity to look at your wage slip in a competent sense and query it. And we've had issues like that even amongst highly educated people who've missed out on pay because they've not read their wage slips properly or not understood the mathematics that was involved in it. And again, in a cultural sense, how many adults will be happy to admit that they're not good at mathematics? So it's a cultural issue that we have to deal with as well, in a way that they would never admit that they couldn't spell or read. It's okay to say you're not good at mathematics. It's okay in that sense. And there's a montage that's been created of Hollywood movie clips where they show maths in such a negative light. It's the thing that the nerds do. It's the thing that the not so cool kids do. The cool kids don't do that. So the image of someone who's good at maths is not a very impressive one that a lot of children want to follow, and that's something else that would need to be tackled. Then we'll look at all the different areas that mathematics difficulties can arise from, and I've split that up into environmental, biological, cognitive, and behavioural. You can have impairments in any particular area. That you don't have to have impairments in all areas for you to have dyscalculic or numeracy difficulties. The biological areas there would be the dyscalculic difficulties, and they would have an impact on your cognition and on your behaviour, of course. And the environmental areas more likely to have an impact on numeracy difficulties. But there's quite a few key things then, a lot of comorbid conditions and conditions before birth even that can have an impact on numeracy development in particular. Then we're going to look at the numeracy development from the perspective of two cognitive theorists, and there's only two people who've actually talked about mathematics from a developmental perspective. Lots of other researchers have talked about learning theories in general, and that would apply to mathematics as well within reason, but only Piaget and Vygotsky, both born in the same year but very different lifespans, talk about mathematics directly. So we would look at Piaget's theory going through his sensory motor stage, moving on to his pre-operational stage and his concrete operation stage, and then the formal operation stage. So his is a stage theory of development, and he argues that each stage develops on the previous one, and you can't really do much to propel children forward. Of course, that doesn't quite fit with the structure of teaching. We do want to work with children. We do want to promote their development in mathematics and other respects as well, and push them forward. So we tend to go for a more social constructionist approach, which was advocated by Vygotsky. So children acquire cultural tools during the course of their development, and they use them in their life and pass them on to future generations as well, which is the big difference between us and other animals who show a lot of intelligence. Dolphins, for example, and chimpanzees, who are highly intelligent creatures, but they don't seem to advance the way we do as human beings. A dolphin or a chimpanzee from 1962 would be very similar to a dolphin or a chimpanzee today, whereas human beings have changed considerably in that time. We would use cultural tools. They can be physical or psychological, and the culture of the child will explain to them how that tool is supposed to be used, and that's how they get that information, through social interaction with their communities, with their parents initially, and their extended families, and then their communities in general. Initially, Vygotsky would accept that the maturational approach described by Piaget would be prevalent for the first 2 years of life, but after that natural line of development, after 2 years of age, language shoots in terms of ability in human beings, and the cultural line becomes more important, and social interaction between teachers, pupils, and between more able peers and less able peers provides the basis for developing new ways of thinking and promoting development. And Vygotsky coined the term through Brunner of the zone of proximal development, which explains what a child can do now, what they can do with help, where they can be scaffolded and supported, and what they can't yet do in that respect. Vygotsky's cultural tools are encountered initially through social interaction, then they're internalized and become part of the person, so they become intrapsychological. And children can use these socially constructed knowledge systems without realizing the importance of them. And they do that through a process of reconstruction. Over time, they realize how important it is. So counting is a very good example. I mean, to master it, you would need to have one-to-one correspondence, stable order, cardinality and abstraction, but we do it in such a playful way, 1, 2, 3, and children mimic the words, they move objects around, and it's an enjoyable activity, but it's the basis of a huge subject of mathematics, which would then lead ultimately to them managing themselves financially, but also possibly being able to land a probe on a meteorite far away in space, because it's mathematics that allows us to do that, because we can't measure those things physically. We've got to use our knowledge of mathematics to be able to work those things out accurately enough to make them function and work. So lots of mathematics being learned in a playful kind of way initially, and through a process of reconstruction, the importance of it becomes more apparent to a child. Early as maths development, as we've said earlier, children under 1 are sensitive to number and they can subsize. Without counting, they can recognise 1 to 4 objects. And some animals can do the same as well. Horses, elephants, chimpanzees, dolphins, to name a few. Children seem to be able to manipulate numerosity at an early age as well. So if an object is hidden and another one placed behind it behind the screen, they seem to know that there'll be 2 when the screen is removed. So that early understanding of numbers and how they work is already there, and we'll talk a bit more about the experiments, the kind of children that are brought in to do these experiments, and the kind of assessments that are made, because of course these children cannot talk to us, so they can't tell us what they've seen. We have to judge it through other means. Early maths development, there's no real link between initial subitizing and later counting. It seems to be spatial in nature. And children's early informal maths gives way to, and involving concrete objects becomes more formal mathematics and more abstract as they go through their school careers. And then we're going to look at consistently what researchers have found that children can do at certain ages. So ages on the left and what they can do. And one of the ones that's really nice, I find, is the one at 2.5 years, where children realise that there's a set of number words. They know you're talking about numbers when you use language like 3, 4, 5. They don't necessarily know how many to give you, but they do know that every number other than 1 means more than 1. So if you say 2, 3, 4, or 5, they may not give you the right number, but they know not to give you 1. They know to give you more than 1. And that's a consistent finding at 2.5 years, which is quite early on in a child's life. And that's when language starts to develop and accelerate as well in children. The researchers have suggested that earlier settings should emphasise seeing counters in different recognisable forms, emphasising one-to-one correspondence, using a gesture of counting when you're doing cardinality, recognising equivalents greater than or less than. And there are tools like the earliest foundation stage and developmental journal that provide good assessment criteria, and also what to do next in terms of promoting development in mathematics. Also, we're asked to promote calculation, so emphasize that number words and symbols represent quantity, showing the relationship between consecutive numbers, 1 more and 1 fewer, and building a secure understanding of counting words, counting forwards and backwards from a given number other than 1, to develop a really strong connection with the number grid system so that children can understand numbers in a concrete way and then in an abstract way as well. Shape space and measures, there's less research in this area, but still some remarkable things have been found. Babies can distinguish between closed and open geometric shapes. 3-month-olds can be distinguished between 3-dimensional shapes, and 5-month-olds can be taught to identify the irregular angle in an isosceles triangle. Amazing. Why would you bother? But it's there, and it's been done by researchers. But handling shapes through play is the best way of learning about them still. Recommended pedagogy, again, it's talking about social context, make it exciting, making it interesting, develop the number sense of children. How many do we need? Who has more? Will the dinosaur fit in the playground? Ask interesting questions like that. Delay formal maths until children have a very good understanding of the number system. Increase practitioner confidence in mathematics, because children can quickly realise that there's a lack of confidence in the person who's teaching them, and they can and lose confidence in them. And maths knowledge is a good of later school achievements, so there's a very, very good reason for good, motivating preschool experiences. Again, the William Review did realise that it's socially acceptable to profess an inability to cope with mathematics, and parents need to reflect on that and play an active part in supporting their children. Primary teachers lack confidence in maths, and children can sort of detect that lack of confidence. Schools should have at least 1 mathematics champion to champion the subjects, and maths should be seen as important, real and interesting, not abstract, alien and frightening, as it can so easily become. Then we're looking at assessing numeracy skills. There's lots of different instruments that we can use. Here I've listed a few of them. You've got the earliest foundation stage, the revised Sandwell early numeracy test, 2 versions of it, one for 4 to 7-year-olds and 8 to 14-year-olds. Very good test. Really reduces the anxiety levels of children, so you get a pure measure of their mathematics without the anxiety. You can help them in terms of calming them down, helping them to breathe, because some people have quite anxious about mathematics when they get to it. and then you get a real understanding of what they can actually do rather than what they're trying to do under anxiety and distress, which of course shuts down their brain and they can't think properly. School and national tests are very useful as well, but there's some caveats in that, depending on, because one child could have got the same results of another, but they've got very different profiles of mathematical skills, so you need to probe further into what they can do. Psychometric tests, the kind that educational psychologists would do, have a mathematical component in them, and that can be used. And of course, there's a Dyscalculia screener, which I've mentioned earlier. I would love to go into more detail with the Sandwell early numeracy test, the revised version. That looks at, so we'd look at it, if possible, if we can meet face to face. If we have to do it remotely, we might not be able to do so. But I would encourage you, if you can buy it for your school, it's not that costly, and once you've got it for life, really. There's two parallel forms. It measures skills from the old national curriculum P6 to 2A, so that we're talking about that lower end of mathematical ability, and it looks at the very basics: identifying number, object counting, oral counting, value computation, and language. And it's really good to get a baseline of skills, identify skills for targeted teaching, monitor the impact of intervention, and group children with similar attainment to facilitate teaching. So it's quite a useful resource in that respect. Now, numeracy difficulties are equally common in boys and girls, unlike dyslexia, which is more common in boys. Children who've got national curriculum level 1 at age 7 or level 3 at age 11 have got some degree of numeracy difficulty, and it's marked if they've not attained those levels by that age. And numeracy interventions can work at any time, and we don't have to be long in duration. The earlier and more targeted they are, the better. But numeracy difficulties are quite difficult. They're multi-componential in nature, so you can have discrepancies in any two components, and there's a wide variety of characteristics and performance deficits in children. So it's so complex to address this area that teachers need support from professionals like specialist teachers and educational psychologists. And you look, and as I said, because it's a multidimensional entity made of all these things, knowledge of counting and numerical combinations, number production and comprehension, ability to execute procedures and follow algorithms properly, understanding magnitudes, numerical principles and mathematical knowledge, very, very complex areas of mathematics. So that's sort of a demonstration of how multidimensional it is. Number production itself is complex enough. You've got to translate a verbal and written Arabic form into a semantic representation in your mind and do some kind of comprehension of magnitude and place value. So huge demands in mastering just the basics, and it's no wonder that some children struggle to master the basics. Consistently, we've found that children with numeracy difficulties have deficits in retrieving basic numerical combinations, and they have less sophisticated counting strategies, often resorting to their fingers. Teaching numbers 10 to 20 is important. The English number system doesn't follow the rules, like, for example, the Japanese number system or the Chinese number system, which are more opaque, will follow. So we don't have an ordered pattern until we get to 20, and then it is more ordered. So numbers 11, 12, 13, 15 don't follow the pattern. Otherwise, it'd be 11-teen, 12-teen, 13, 3-teen and 5-teen, just like we have 14, 16 and 17, so on. There's also a common confusion between 12 and 20, and we think that's got a phonetic link, which we'll discuss in more detail. And number bonds to 10 and then 20 are important, and precision teaching works really well in developing those skills. These are the 8 strategies that people have said are good for basic numeracy competence. So being able to plus or minus 1, plus minus 2, plus minus 10 from any number, knowing your number bonds to 10, knowing doubles and near doubles, realizing that 9 is almost 10, so 99 and 99, convert it to 100, 200, take away 2, so the answer is 198, doing it like that. Bridging through 10, which is a more modern concept, but it seems to work for children who are going through mathematics teaching now. And complementary addition, which is the old counting backwards like shopkeepers used to do when they used to give you change. And those are skills for basic competence in mathematics. Then we'll look at literacy difficulties and numeracy difficulties together. So children with dyslexia, about 50% comorbidity between dyslexic children and children with numeracy difficulties. And competence with reading seems to ameliorate numeracy difficulties, but it doesn't work the other way around. So we'll discuss some of those issues. Where you've got lots of language in problem solving and questions, of course, people with literacy difficulties are going to struggle, but where it's not a major difficulty for them. Working memory is another aspect that we'll look at. We've got the working memory split up into the phonological loop, the visual spatial sketchpad, and the attentional component, the central executive, and all of those areas are linked to actual specific attainment in children. So we'll go through some of these things. Gathercole and her colleagues found links to national curriculum tests between deficits in the central executive and the visual spatial sketchpad and the phonological loop. So important connections between working memory and numeracy development. And of course, if working memory is weak, children can't commit numeracy facts to memory, and information decays too rapidly for them to make connections, so they can't build that a cognitive network that they need to be able to do mathematics more easily. But you can improve memory, like you can build muscles, and precision teaching is a way forward in that respect. Number sense is another concept that's important in mathematics. This connection is a model between realizing what values you should be having and what kind of magnitude you should have in certain areas. And children who've got a good number sense can develop higher levels of attainment later. And the connection is a model which says that mathematics is a connection between symbols, language, pictures, and concrete experiences. And if you get that sort of foundation in children and ask the right questions, you can develop their mathematics much better in that respect. Diagnosing numeracy difficulties, as I said, people need support because it's very complex. So interventions need to be done by professionals who are outside of the educational everyday work with children, and who may spot and see things that teachers may have missed. And we'll look through the different things we can do: diagnostic tests, parent and pupil interviews, teacher assistant interviews, look at the waves of intervention and some of the interventions that are out there for overcoming barriers in mathematics, and then looking at how to help. So using transparent language, using explicit math instruction, unambiguous explanation, think alouds, and then structured teaching. Teach foundation knowledge, teaching very small progressive steps, carefully limit the memory demands, and use enjoyable repetition, and guide carefully from concrete to abstract maths. And as I've said with the connectionist model, building those connections between symbols, language, pictures, concrete experience is really important. And of course, numeracy interventions can work at any time and don't need to be long in duration. And the more earlier and targeted they are, the better. So hopefully something has excited you there, and you will want to come to the longer course that will be available, and we can discuss in a little bit more depth some of the issues that I've touched upon there briefly. Okay, thank you very much for listening.